for that. So a clinical officer is a medical practitioner who is licensed to actually practice, treat, treat patients. So in Kenya, clinical officers is the oldest medical practitioner, which started in 1928. In fact, it's even older than any other. And the reason it started because during that colonial era, we didn't have a lot of doctors and nurses and so on. So after that, we have had this profession for all that long. So they are a bit different from medical officers because they almost work the same way, but their work is to complement medical officers. So I would say their role mostly, if you go to any outpatient clinic today, especially from level 5, which is district hospitals, health centers, dispensary and community health, chances are you will meet clinical officers in the outpatients. So in summary, I would say clinical officers are basically the custodian of primary health care in Kenya. And having said that they are mostly localized in the outpatients, it doesn't mean that we don't have specialties who work in the inpatient. We actually do. However, those who work mostly in the outpatients, we see them as the first line of defense in our healthcare system. So meaning that if a clinical officer is not able to pick a certain disease, then chances are it cannot be seen by a medical officer or even a consultant. So with that, the government has really invested in training clinical officers because there's a first contact with patients. If you go today to maybe somewhere like Mama Lucy, the first person you will come into contact with is a clinical officer who has to make judgment whether for you to be seen by a consultant, whether for you to be admitted, and so on. So you can see they play a very critical role in Kenya. And even if we give an example, if someone has cancer and they don't get diagnosed by a clinical officer who stays in the outpatient, chances are you will miss and then you will come at a later stage. And that is why the government has really invested in training clinical officers. And right now, which is different from previously where we used to have clinical officer doing just certificate, right now we have clinical officers doing diploma, doing bachelor's, and even doing master's degree. So that in general sums up the clinical officers who are actually protected by the Kenya Constitution and having a cap, which is Act number 260.
Okay, so they're the first point of contact.
Yes, sure.
With the ill, the
yes,
patients.
The patients, yes.
All right. So, Dr. Mokera, looking lovely, I have to say, looking lovely.